to our next episode of the Hormone Café. I'm Dr. Sarah Pederson. I am an OB-GYN and I specialize in holistic hormone balance and fertility. We are going to talk about cervical mucus. Yes, cervical mucus is very important to your fertility and to your overall health. I had a patient who I saw for the very first time, and I always ask my patients, how's your vaginal health? How are your bowel movements? How's your cervical mucus? Sometimes really intimate questions. And she said, oh my gosh, Dr. P, why do you keep talking about cervical mucus? I've never thought about my cervical mucus. I've never felt my cervical mucus. And I said, all right, well, we're here. We're going to talk about it. We're going to learn about it. It's really important. And now she knows a lot about her cervical mucus and how it's important to fertility. And the reason that it's so important is because it teaches you a lot about when you're ovulating and the underlying health of your body. So we're going to go over what is cervical mucus, why is it important, how do you know if it's high quality, and what can you do to make it better. So what is cervical mucus? So what is your cervix? Your vagina is a long tube. Think about it as a toilet paper roll. And then think about your uterus as a balloon. So how do we connect that balloon to the toilet paper roll? That's through a little rod that's called your cervix. So your cervix connects your vagina to your uterus. And your cervix is made up of a canal, which we call the endocervix or the endocervical canal. And those cells that line the canal make mucus. And it's responsive to hormones. So depending on what your hormones are doing, it tells the cells whether to make more or less mucus. Cervical mucus is made by the cells in your cervix, and it's composed mostly of water and then something called mucin, which gives it that mucousy, gelatinous texture, and protein and carbohydrates, which are sugars. So when we think about our nutrient diversity, it's extremely important to have a lot of nutrient diversity because there's a lot of components of good, high-quality cervical mucus. Why is it important? Well, the cervical mucus helps the sperm go from the vagina to the uterus. It's like the gamekeeper. It decides whether the sperm can go through or not. For example, if you have cervical mucus that is either too dry or isn't thin or it's too sticky or it has an pH that's abnormal, your sperm is not going to be able to go through the mucus. You want to think of it as like a 9-lane highway. You want all the lanes to be open. You want all of them to be straight. You want your cervical mucus to be healthy so that the sperm can go right from the vagina through the cervix to the uterus. So that process is really important. Not only is it important for fertility because we need high quality cervical mucus for the sperm to get to its final destination, but it also tells us about our underlying health. If we have too much cervical mucus or not enough cervical mucus, both of those things are problems. So how do we know if our cervical mucus is high quality? When we think about our cycle, first, we're going to have our period. So we bleed, our bleeding tapers off, and then you'll have a few days of what you consider dry. So you want to be feeling like your vaginal tissues are not really wet or really lubricative. And then starting around cycle day 10 to 12, you should start noticing that your vagina feels more wet. And when you wipe, you should notice that there's this glop on the toilet paper that's clear that you can stretch more than an inch. When we consider high quality cervical mucus, it should be very obvious. You should wipe and, oh, that's a difference, that's a change. Not you have to reach inside, you have to feel it, you have to look under a microscope in order to see it stretch. High quality cervical mucus is very obvious. And in a perfect world, we would have high quality cervical mucus for at least 3 days around the time of our LH search. Cervical mucus corresponds with the LH search. And then that's the day that you want to have sex, the day where you have high quality cervical mucus and a positive LH search. So after our cervical mucus builds up, we wipe, we can see it, it's gloppy, coming off of the toilet paper. After we ovulate, then our corpus luteum and our ovary makes progesterone. Progesterone should dry up your cervical mucus. So after ovulation, you should not have any more cervical mucus. So if you're a person who doesn't get cervical mucus at all, or gets cervical mucus all the time, or a long time before ovulation or a long time after, those things are not normal. Or if your cervical mucus is really yellow or it's sticky or thick, that can be a sign that something is wrong. Cervical mucus is responsive to our hormonal changes. So when we say, okay, what can we do to make our cervical mucus better? We got to think about the underlying causes of how cervical mucus is made. Cervical mucus is made from a rise in estrogen. We really need our estrogen to be going from low at the beginning of our follicular phase to high around the time of ovulation. That change in estrogen tells our cervical cells to make mucus. So if our estrogen is really low, oftentimes that can be associated with poor quality cervical mucus. So one, we want to focus on causes of low estrogen and how to get our estrogen up. And then two, sometimes we can give bioidentical estrogen. Sometimes we'll give that orally in the form of bioidentical estradiol or vaginally. Estrogen has a lot of anti-inflammatory properties and it's called angiogenic properties, meaning it grows new blood vessels. And so sometimes vaginal estrogen can help grow new blood vessels and get a healthy blood flow to our cervix, which can help improve the quality of our cervical mucus. So paying attention to our estrogen is very important. Making sure we're ovulating is very important, because that cycle of growing healthy cervical mucus and then having it dry up is healthy for our overall cervical health. And then when we think about our cervical mucus and all its different components, it's extremely important to be hydrated. If you're not noticing any cervical mucus, the first thing you should do is drink more water, because cervical mucus is 95% water. I know that sounds kind of silly and maybe obvious, but you literally need to hydrate enough so that your body can make lots of mucus. The other thing is that you need to be eating enough protein, because cervical mucus is literally made of protein. Cervical mucus also has anti-inflammatory components. So we need to be doing things that support our immune system. For example, having a protein like we talked about, and then lots of antioxidants. So anything with glutathione, which is going to come from our leafy green vegetables, any vegetables in general, and then oranges, citrus for our vitamin C. We really want to promote and support our antioxidants. And then same thing when we think of supplements that support our cervical mucus, they support those things. So supplements that support estrogen production, for example, omega-3 is a really important one. And then supplements that are antioxidant, we're going to think about our vitamin C, our glutathione, our NAC, or our N-acetylcysteine. And then the supplements that support blood flow. So things like alpha lipoic acid and vitamin E, those types of things can help improve our proteins, decrease inflammation, help improve blood flow to our cervix. So those are the types of things that we think about when we're trying to improve cervical mucus. So if you go through a whole cycle and you're not really sure how to read your cervical mucus, you're not sure if you're getting high quality cervical mucus, please come to us and sign up for a hormone coaching session. We will teach you how to read the signs of your body, how to read if you have good quality cervical mucus, and what that means for your cycle, and make sure you're having good, healthy cervical mucus, which is a sign that you have healthy hormones and a healthy nutritional status and healthy hydration, so that we can get that freeway all cleared up, get the highway cleared so that the sperm can most easily go from your uterus, from your vagina to your uterus. If you have questions, please sign up for a hormone counseling session. We can teach you about your body and make sure that there aren't any red flags. Thank you for joining us today on this episode of the Hormone Café. Next episode, we're going to be talking about PMS and PMDD and what that is. So don't forget to join us for that next episode.